It's informative, it's healthy, and it's the news. Welcome to the Health Connection. Welcome to this week's special episode, Your Healthy Mind.
Hello everyone, good afternoon. Welcome to another episode of the Health Connection. I'm Kishai Martin, a peer navigator for Care Resource, as well as your host. Today is all about your healthy mind. And joining me today are guests from behavioral health, starting with Tiffany.
Hi, my name is Tiffany Wheeler. I'm the Behavioral Health Services Manager for Miami here at Care Resource, and I'm also a licensed mental health counselor.
Thank you, Tiffany. Next is Hugo. Hugo, I don't think I can hear you. If you don't mind, please, let us know who you are. We want to know who you are.
Hello everyone.
There you go.
My name is Hugo Rocha, and I'm a licensed clinical social worker working as a behavioral health service manager here in Broward.
I'm glad you're here, Hugo. Thank you.
Thank you.
And last but not least, Edith.
Hi everyone, my name is Edith Caballero and I'm a licensed clinical social worker. I'm also the lead clinical counselor here for Midtown, and I'm glad to be here with you guys.
As are we, Edith. Thank you for being here with us. There's quite a bit to discuss today. Obviously, 2020 has been one of those years for history, for records. And the behavioral health team is going to discuss everything from COVID and mental health, social distancing, isolation, substance use, working at home, access to mental health, as well as relationship strains. So let's just go ahead and start with the first topic.
So hi everyone. So COVID is a really huge, unexpected disaster, and it's kind of impacted everyone. The only good thing about this is that the entire world is kind of going through this together, and we're kind of figuring it out together. But it doesn't make it any less scary, right? And it doesn't make it any less of a challenge. So many people have really been impacted in so many ways. You know, one of the first things is employment. People aren't able to go to work. They're not able to go into the office. So that impacts our finances. And that's a huge issue, right? Some people don't know how they're going to pay their bills, if they're going to be able to sustain themselves, sustain their living. You know, so with the loss of work and going in, there's also a loss of time due to the fact that we don't really have any schedules or routines anymore, right? All of our routines are disrupted, and it kind of makes us feel as if there's a loss of sense of self, right? Loss of motivation. People are kind of wondering, like, what am I doing with myself? What am I doing with my life right now? And we're kind of left with ourselves to deal with our own feelings, to deal with our emotions. And that can be really, really challenging to just kind of have to sit with ourselves and process our thoughts and our feelings and our emotions. There's also this inability to see our family and friends and engage in life the way that we used to. Since the beginning of COVID, I don't know about you, but for me, it feels like every single month there's something. There's some type of negative impact, something that we have to deal with or adjust with. And that can kind of take a huge toll on our mental health. We experience way more anxiety, way more depression because of these uncertainties and because of these challenges that come with it. You know, there really isn't any clear-cut answer on what to do or when this is going to end or when we're going to go back to normal or even what normal is going to be after all of this, right? So there's this fear. And this fear of the future, the uncertainty, what's going to happen to me, what's going to happen to my life, what's going to happen to the world. You know, all of these things can come up and cause us to feel anxious. and we can experience things like depression, anxiety, fear. We have excessive thoughts. I know all of us have a little bit of compulsivity. We're super compulsive with washing our hands now, sanitizing, making sure we keep everything clean because of the fear of, COVID and potentially catching it. So it's definitely impacted all of us in our mental health and how we interact, not only with the world, but, how we interact with each other.
Well, thank you, Tiffany. That was honest. That was the reality that we're all living. And we're going to get further into it with the next topic.
Yeah. Hi, everyone. So Tiffany mentioned something very important, and she mentioned about kind of that losing touch with the people that we love and care for. So there's a huge difference between isolation and social distancing. Social distancing is, well, let me start off with isolation. So isolation is having no contact, right? No contact at all, like reclusing to yourself in your own space. And we'll talk a little bit more about that. There's a problem with that. Versus social distancing. Social distancing is us keeping a safe distance, about 6 feet apart, wearing our masks, washing our hands, safety protocols from the CDC. As we're interacting with people like our family or our friends, keeping that distance, wearing our masks. And it doesn't necessarily have to be that you're in person with someone. You can social distance from the comfort of your home. The point is that we want to continue to connect to the people that we love and care for, and the people that are going to support us and make us feel good. So this is where, Facebook comes in. This is where Zoom comes in. This is where like messages and phone calls. This is us still being in connection with the people that we care for, the people that support us, and the people that care for us as well. So there is a difference between isolation and no contact with anyone to social distancing and just keeping that safe distance if you're going to see someone, or not see that person, but still be in contact with them. And I think for a lot of us, there's this misconception that you have to isolate, right? You have to isolate. You have to just be in your own space because we're very scared and we're very fearful about COVID. And your people are absolutely right to be fearful, but don't lose contact with the people that love and support you. And if you feel you don't have that support system, well, let's create one. Let's reach out to maybe people in our past that for whatever reason were helpful and supportive to us. This is a time to reconnect. This is a time to reconnect with the people that were positive and promoted our well-being. This is not the time to reconnect to the people, let's say, that were not positive. I'm not talking about we got to reconnect with the whole world, right? So if someone wasn't good for you before COVID, they're not going to be good for you after COVID or during COVID. So we want to make sure we're connecting to the right people. And if you don't have that support system, there are a lot of support groups out there. There are a lot of support systems out there. To give you an example, I'm part of a support system in Facebook that's called Social Girls. And it's for women who just want to socialize with other women who are positive and uplifting. That's an example. I don't know, I can't give you more than that, but our behavioral health resources page on our website will give you many more resources, support systems that you can reach out to if you're feeling depressed, alone, isolated. So there are support systems out there if you feel like you're all alone, and that you don't have that network of people. So again, we just want to be careful who we're connecting to during this time. And during this time, when people tend to isolate, right? And we talked about the difference between isolation and social distancing. Isolation kind of prompts people to use substances or not only substances, but just negative coping skills. Those negative coping skills that we've had from the past where, we either would eat too much, right? A lot of my clients have been saying, oh my God, I've gained so much weight during this time. I've been so anxious. I've been so stressed. So, for some of us, it could be that negative coping skill of maybe drinking or smoking or reaching out to someone who wasn't good for us, And this is why I wanted to touch a little bit about substance use. Time has been blurred, and Tiffany mentioned about like time and the uncertainty of this pandemic. the time has been blurred. Literally, some people are at home. They don't know, they're not eating at the same times they were eating. They're not going to work, anymore. They're not coming out of their houses. So people are just at home, and like time is like a blur for people, right? There's a dysfunction in the times that we used to eat or the times that we used to do certain things. So it's a blur. And for a lot of people, it could just feel like, well, you know what? Let me take a drink after work. Let me do this, or let me smoke a joint, or let me do that. And then when you come to realize you've been pretty much in an active, just actively using something without even noticing that you were using it a lot, or using it more than you usually do. So, and the reality is that when we're stressed, we tend to go back to those negative coping skills, whether they're people or substances or food or whatever it is. And it's kind of a reflection of how we've dealt with our issues in the past, where we've gone back to those negative coping skills. And the reality is this pandemic has people's traumas coming to the surface, right? So if someone had a trauma in the past about like fear of the unknown, oh my God, the fears of the unknown, everyone, that trauma is definitely prevalent and in the surface right now. And we're using those negative coping skills to kind of bring that distress down, because it solves a problem in the moment, but it doesn't in the long term. So a lot of people, again, it's the uncertainty, it's the what's next. I don't know what's next, and a lot of people are using, negative coping skills, and not even realizing that they are. So basically, our behavioral health resources page is a wonderful resource for anyone who's really looking to reach out to a lot of community services and resources that are out there that can help you if you feel alone and you feel like you're kind of using again, or you relapsed, like you were in recovery, or maybe you were abstinent from something, but then you've gone back to that behavior. To reach out to a community of a 12-step program, or a support group, or a Buddhist recovery group, whatever it is that helps you. And most importantly, and we're here also as a team to care for you as well. You're not in this alone. And I know that Tiffany and Hugo are going to talk a little bit more about that, but we're here to serve you. We're here to care for you, and you don't have to go through these mental health and substance use and family issues alone. We're here for you. So thank you, everyone.
Thank you, Edith. That was very encouraging, and you really did speak to many feelings and fears that all of us are facing. I appreciate that. And we are going to get into our next topic, and I believe Hugo will be taking the floor next.
So we hear a lot that we are confined working from home right now. And we are confined sometimes in smaller spaces. And what we are seeing is a lack of boundaries. So our office, our bedroom, the restroom are all kind of together, and we don't have a physical distance between one and another. So I'm going to give you a little bit of some insight into what can be helpful to you in setting some limits and boundaries, things that can help you create different spaces at home while you are working, when you need to work from home. So the first things that I want to make sure is that you set time limits. There is a time where you start working and a time where you end working. Make sure you follow those guidelines. So then you also need to prepare for working. Make sure you try to take a shower and dress for your job. So that helps you get the feeling and get in the mood of start working. So that start creating psychological advantages in working from home. Another thing that you need to start thinking about is to create lists. Establish priorities and timelines. Certain things are more important than others. On a daily basis or on a weekly basis, just create a list. certain things need to happen before at the beginning of the week, or they are a priority for your personal life. The other thing is that we have to start sticking into regular hours. I remember my grandmother and grandfather talking about this from years ago, and I was like, no, it doesn't matter, like, no, we have to start sticking to hours. This is the sleep time, this is the work time, this is the time to have dinner, have fun, relax. So start creating habits at home that clearly separate different activities that we have during the day. Another thing is that we should start slowing down a little bit. With the online environment, we start multitasking. But the reality is our brain does not handle well multitasking, and it will, kind of use all our psychological resources trying to focus on so many things at the same time. So slow down and focus one thing at a time. Another advice is use calendars. Identify days and times and resolve conflict. So if there is several members at home, you wanna make sure that you know your children's calendar, your husband's calendar, wife, and you know exactly what they're gonna have, what are the important events of the week. Kind of like if you know that somebody is gonna need a room for their own work, what room are the other person is gonna be? And we're gonna make sure we communicate with our family members. We tell them what we need to do and how we need to do it. Another thing that is very, very important is manage frustration. So if you, there is probably going to be a lot of conflict, and communication within family members or your roommate are effective tools to resolve conflict when we are working at home. So from this topic, I'm going to pass to the next topic, which is relationships. So we hear a lot about that family members at home are all the time, and there is this togetherness that could be really overwhelming. The best advice for this is self-care. We have to start having a routine that helps us feel better in whatever it is. Think about what you were successful before the pandemic, whether it's yoga, exercise, going to the gym, or dig in the garden, walk the dogs. But make sure you get into a self-care routine, because if you are not well physically and intellectually and psychologically, it's sometimes very difficult to engage in healthy relationships. So let's start focusing a little bit more about us and what can help me feel better. And there's many things, that already our colleagues were mentioning in this new normal. Let's try not to use substances. Negative coping mechanisms are really damaging our capacity to relate to each other. So the cocktail time in the afternoon, think a little bit about that. You might want to engage in relationships with a fresh mind and connect directly without necessarily being under the influence of any substance. Another good advice is broaden your support system. What I personally experience is sometimes that some of the old friends just needs to, there is some changes happening here. Some friends are no longer your friends, and you need to look for new friends, because sometimes things change, particularly with the pandemic, and particularly how people see the pandemic and how we perceive we should proceed and how we should take care of ourselves. So broaden your support system is very useful in your relationships. Another thing, be more patient and considerate with others. not only you, but the rest of the people here are going through a hard time. This is really difficult for many of us. And being compassionate and forgiving probably will be very, very helpful. Just to wrap it up, ask for help if you need to. Learn to be vulnerable. Call your friends or call Care Resource. We have a great team of therapists that will, for sure, provide the best mental health care that you need. All right. So that's it from me. Thank you so much.
Thank you, Hugo. Now, I just want to let the audience know this is a lot of beautiful information in such a short amount of time, but there's so many valuable points being made. Rewatch the show and write it down. Make a list, just like Hugo mentioned. So I am going to move on to the last topic of our show today, and I'm going to bring back on Tiffany.
Hi, everyone. So we just want to remind everybody that, here at Care Resource, we do have behavioral health services at all 4 sites. Currently, right now, we're offering our services via telehealth. For very special cases, we're allowing clients to come in, but for safety reasons, we prefer to just go ahead and administer our behavioral health services via telehealth. So in our behavioral health department, we offer therapy, individual counseling, couples counseling, family counseling, group counseling, do it all. Our group counseling topics, they consist of things such as mental health, such as depression or anxiety or trauma. We have substance use counseling, risk reduction sessions. We do LGBT services, HIV specialties, care and support. We have parenting groups. We have children's groups. We have over 20 licensed and trained specialized professionals from all backgrounds. We speak 3 of our main languages here, and we're all ready and waiting to assist and be of service. We also specialize in our department. We also have our employment specialists and our community behavioral health specialists who are ready to assist anyone with linkage to employment and other specialty services. On our Care Resource website, like Edith mentioned, under our behavioral health services, we also have a list of resources that are available in the community. Things that can benefit the client, things such as maybe homeless shelters, domestic violence shelters, support groups such as AA or NA or CMA, or other specific needs centers. And these are groups and agencies that we are partnered with or we support to go ahead and give specialized care and services needs. But most importantly, we want everyone to know that during this time, nobody has to go through this alone. Care Resource, we want to be here and present for you, and we want to be able to meet your needs, whatever they may be, whether it's behavioral health therapy services or our medical services, our dental services, case management, we do STI testing, our food for life, whatever it is, we want to be able to make sure that we can give you the help that you need. So we want everyone to reach out, give us a call, go to our website, and just let us know, how can we care for you today?
Behavioral health specialists do so much for their clients and their patients, and they also need that support and that encouragement. And as someone who loves therapy, I've always wanted to know, what do they do to take care of themselves on a daily basis? So I'm first going to start with Edith.
Yeah. Hey guys, so as I was saying, what I find that is helpful for me is a meditation practice. I meditate twice a day, and that's become, part of my daily self-routine. I call it, mental hygiene. The same way I brush my teeth, the same way I take a shower, it is part of my hygiene. My mental hygiene to do meditation. I also practice yoga, and I also exercise as well. Thank you.
Awesome. Thank you, Edith. Now, next, I'm going to go to Tiffany.
So for me, during this pandemic, having to work from home for a period of time, it was really important that my space was really clean. I can't function in a space that is really dirty. So I actually took the initiative to clean the house from top to bottom. And it also gave me the opportunity to get rid of things I didn't need. So I went through my closet and, shoes and clothes that I didn't necessarily use anymore. I decided to go ahead and donate them. So For me, having a clean space, a clean area, it allowed me to work better and it allowed me to feel better. Other things I did was spend a little bit more time reaching out to people who I haven't really talked to in a while. I took the opportunity to reach out to like high school friends and like girlfriends that I used to hang out with back in the day, people who were good for me. And it was really nice to just like catch up and reminisce about the good old days and things of that nature. But I also was able to develop my own self-care routine, having bedtime routines, incorporating like aromatherapy before bed, turning off social media and stuff. Because after a while, you kind of gotta, put all that stuff away and just sitting with yourself, like relaxing into sleep, aromatherapy. I do bedtime yoga as well and meditation before bed. And all of those things were really, really helpful for me. And eating better. I try not to eat like garbage, although you wanted to, but I found that, when I had only healthy options in the house to eat, only healthy options, it made it easier to not like put on the COVID-20, so healthy options in the house, guys. Grapes and get rid of the soda, so yeah, that worked for me.
Yes. No, I appreciate that. And honestly, a lot of the things you said are things many of us are doing right now, as well as Edith. And last but not least, Hugo, what's going on with you?
Yeah, well, I very similar to them. I have a yoga routine on a daily basis. I found a technique that is called Ashtanga yoga, which is a repetitive kind of class, and I just found this profoundly positive for my mind and my body. So it has been very, very positive. I think it decreases the whole brain, the reaction to, sometimes we have this negative reaction to survival or, fight, escape, freeze. So that part of the brain really gets targeted with this Ashtanga yoga. And I just find it so beneficial. And that include 5 minutes of meditation at the end of the yoga class. Additionally, I might walk the dogs in the morning and in the afternoon. I kind of socialize with my neighbors a little bit, maintaining distances. So it's pretty much that's what I do. And also I put a lot of emphasis in my friends and if I can celebrate their birthday, and I use kind of like, bring cake or things, just make it meaningful. And I learn a lot about that from my team. They like to celebrate birthday a lot. So I just like, they are a positive influence to me. That is totally new for me. I never celebrate much of a birthday. And now I feel like, let's do it because I need that happiness. I use any opportunity to be happy.
All right. Well, thank you, Hugo, for sharing. And once again, thank you all for being a part of this. I loved hearing every tidbit you all shared. This is a very scary year. It's very unprecedented times, but there are still things we can safely do that will keep us not isolated from people, keep us connected, and keep us healthy, more importantly. And you all do such amazing jobs every day in the work you do. You are appreciated. We see you, and I hope you all continue. And that is it for the Health Connection. See you all next month. Take care.
All right.
We live in a fast-paced and complex world. Sometimes it can be hard to keep up, but you can do something about it. Don't let anxiety or depression slow you down. Our trained and licensed behavioral health professionals can help. You can learn how to grow a strong mind for your strong body and connect with the world around you again. compassionate, competent, and committed care, your South Florida behavioral health professionals and your community source for healthcare is Care Resource. Flu season is here, and the best way to prevent the flu is by getting your flu shot. And a yearly flu vaccine is the first and most important step you can take in protecting against flu viruses. To reduce the transmission of the flu, make sure you wash your hands often with soap and water or use an alcohol-based hand sanitizer regularly. Cover your cough and sneeze with a tissue, and avoid contact with those who are sick. If you feel you have the flu, it's important to stay home and fully recover. Remember, a flu shot is not just about protecting yourself, it protects the ones you love. Make sure to consult with your primary care provider first, especially if you've been diagnosed or may potentially have COVID-19. Here at Care Resource, we're committed to your health. Visit us online at careresource.org and make your appointment for a healthier flu season. Don't forget to like us on Facebook at facebook.com/Care Resource, or follow us on Twitter at Care Resource FL, or subscribe at youtube.com/Care Resource. For more information or to find a location near you, visit us online at careresource.org.